to reflect that within the total figure, there's 207 cases that are known, and also just over 3,000 whose addresses are outside Gauteng. Total active cases, 8,614, and the recoveries I've already indicated it's 94.4%. That is the figure, and we have already reported on the deaths. Next slide. This particular slide is showing us the picture per district. And as we note on this slide, Johannesburg has the highest number of cases, followed by Tshwane and Ekurhuleni. So predominantly, the three metros which have the highest population figures, highest number of residents, they are the ones that are having the highest numbers, followed by the two district councils, which take about 12% of the total cases. And the slide is also showing us the picture per district in terms of new cases in the day reported on, the total confirmed, recovered, active, and deaths. And we'll note on this particular slide that according to the number of cases reported in those districts, again, the three metros, that is where we have the highest number of deaths. Next slide. This particular slide is showing us the picture with regard to screening and testing. And the slide is also showing us cumulative figures as at the 1st of February, whilst also showing the number of screenings that were done on the 2nd of February and tests. And the extreme right columns are showing us the total cumulative figures for screening testing per sub-district, with totals provincially being reflected on the bottom line. Next slide. On this particular slide, we're showing the bed occupancy rate in our hospitals, and we have put the beds according to the districts within which the hospitals are situated. On the second line, we see the number of beds available in each district, whilst the top line is showing us the number of patients admitted, and of course on the bottom showing the percentage in terms of the utilization. When we look at this slide, we can note that in all our districts, we continue to have capacity for managing COVID patients, and these particular numbers exclude Nasrec. It will be shown in the following slides. Nasrec is our field hospital. Next slide. This particular slide is showing us the capacity and the occupancy at Nasrec. And when we look at it, we'll see that there's a total of 1,000 beds. And at the moment, the facility is very underutilized, with intermediate low flow oxygen beds having a bed occupancy of 14% and isolation 6%. Next slide. On this particular slide, we're looking at the number related to COVID infections regarding the workers in Gauteng. And this includes both Gauteng Department of Health, the mines, and also National Department workers that are within Gauteng, the private sector, municipal. It includes all the health workers in all the different categories. So when we look at this, we note that Gauteng Department of Health workers, their number is much higher as compared to all the others, followed up by the private sector. And we can see that as at the 3rd of February, there was an increase from 11,539 to 11,541 in Gauteng. And when we look at the others, the numbers more or less are remaining constant. There have not been any increases. It was only in Gauteng and in the private sector. The private sector had additional 8 new infections reported amongst the workers. Next slide. This particular slide is providing the summary of what we have just presented in the last slide. 2 new cases in Gauteng, and also showing that as at the 3rd of February, 82 healthcare workers were reported as having died from COVID-related illnesses, and also 8 new infections in the private sector. And the other sectors have not reported anything. Next slide. With regard to our mortuaries, we are showing the capacity on 2 levels, the forensic pathology services and the capacity in the provincial hospitals. When we look at the slide, it's showing us that the storage capacity in FPS is 1,608, whilst in the provincial hospitals is 1,813, bringing the total to 3,421. And looking at the total capacity available against the occupancy, we note that FPS capacity is at 57% utilization, whilst in the provincial hospitals, it's at 35%. And on an average, provincially, it's 45% of our mortuary capacity that is currently occupied. And in addition to that, there are plans of putting in place mobile mortuaries in the hospitals that have been named there, which will give an additional space of 288. What is being done now is working on the connectivity, ICT, etc., to ensure that this capacity becomes ready to be utilized if it becomes, if it is needed. Next slide. In terms of challenges and mitigations, like other provinces in Gauteng, we still see challenges of non-adherence within communities to COVID protocols. And to manage that, we continue what we call our battle plan activities, which relate to our districts, working out a plan on a weekly basis of communities that we see as hotspots or potential hotspots, going into those areas to conduct education, and also through media platforms communicating information of what people need to do to prevent the infection. With regard to human resources, given the long period within which health staff has been involved with COVID work, in addition to other functions that they have, we're starting to see staff fatigue, which is evident through the sick leave that is being reported, and also the issue, which is not only in Gauteng, I take it, it's a national challenge of not having the required specialists like our ICU nurses, OHS practitioners, and inadequate human resources in terms of some of the demands that we have, and not being able to attract those particular resources, particularly the specialists, nurses, as we have already indicated, on a contractual basis. And with regard to that, the province continues to engage with Treasury in terms of availing additional funds for ensuring that we're able to renew the contracts of those that are on contracts and look at how some of them can even be stabilized. And also The Gauteng Department of Health is using its own provincial contract with nursing agencies to avail human resources to ensure that where there's a need beyond the capacity available, we're able to source from the private agencies. And of course, continual support is being provided to staff to ensure that they are supported psychologically so that they are able to continue functioning. We are not really constrained in terms of the beds, but we are reflecting as a possible challenge if the numbers increase, the issue with regard to additional beds that may be insufficient beds which we may experience. And also we note that in terms of our infrastructure projects, there are some of the projects that were started for COVID which unfortunately have not been completed to date. So in terms of the mitigation, it's continued opening of new wards in facilities. That is part of our plans to say that if there's a need, we'll continue to look at new wards that can be repurposed in order to support COVID patients, and also looking at the work that we are doing within the clusters to ensure that they support each other in terms of referral of patients. If one cluster is having more patients than they can manage, they can be sent out to the other cluster. And also, we have NASREC as a field hospital, which I've already indicated the utilization at the moment is quite low. It's available for all the 5 districts to refer patients if there's a need, patients that are at the level to be nursed at NASREC, which includes patients on oxygen, but that are not really complicated, requiring specialized care. And we are concluding the resourcing of 300 beds at Jubilee, and this will assist in decanting PUIs within that area. The last challenge is on the increased demand for public health services beyond COVID. We are aware that COVID has really taken a lot of the resources that we have as a department, including the HR resources. And in terms of that, the resources are overstretched, and we are continuing to assess ways to stretch the current resources to ensure that we continue to meet the demands for COVID, whilst we also meet the demands for the other services that are required. Thank you very much, Chair. I think my presentation ends here, and Mr. Malele will be taking over. Thank you very much.
Okay, continue, Mr. Malele. Thank you very much.
Thank you, Chairperson. Thank you, MEC. Thank you, honorable members. I'm going to take you through the rollout vaccine rollout strategy. This is the context. The National Department of Health has developed a vaccine rollout supply chain that commences from the 1st to the 10th of February 2021, the 10th being the date of vaccination at the approved sites. This is a multi-sectoral team led by the HOD, inclusive of labor formations and other stakeholders, has been established to implement the vaccine rollout plan. The Gauteng vaccine rollout plan is aligned to the national rollout plan, and therefore this requires the province to work closely with NDOH. There are a number of dependencies and constraints identified for the successful rollout phase 1 of the plan. The identified dependencies and constraints include, amongst others, the following. timing of the rollout of the EVDS system, which is the system that will be used to register patients and to where staff members will be able to enroll and book appointments for the vaccine, so as to allow for the provincial dry run of the system prior to vaccination. So we actually requested NGOs that we need to be able to do dry runs, which we make sure that the system is actually fully functional. Dependence on NGOs to timelessly supply dosages for both doses. Right now we have received 1 million doses for the entire country. Gauteng will be getting 85,500 doses for the public sector and 130,000 for the private sector. A national security plan on cold chain logistics and transport has been developed and will be rolled out to provinces. We have met with Prof. Joint today, and we have discussed our concerns in terms of security. They've asked us to provide some information so that they can assist in terms of coming up with a security plan for the vaccines. Additional capacity required for data capturers and clinical observers for adverse events. Continuous power supply in vaccination sites to ensure uninterrupted cold chain. Inadequate physical space at the vaccination sites resulting in extended vaccination period and possible wastages. Next slide. So the Gauteng intends to vaccinate 67% of the 15,488,137 population, which comes to about 10,377,452 people that will be vaccinated. And the vaccination will go into 3 phases. Phase 1 is the frontline healthcare workers, which we are targeting 215,101. And phase 2, it's your essential workers, and it's your persons in congregate settings, and it's people over the age of 60 years, and people over the age of 18 with comorbidities. And phase 3 is the general population, which is for people over the age of 18. Next slide. In this slide, we're looking at the public sector target population per district. So here we're looking at the number of employees in that particular district and the number of facilities in that district that will be used for the vaccination, and the different levels of care in terms of central hospitals, tertiary and regional and district, and the number of vaccination sites vaccination sites in that particular district. So here are the 5 districts as depicted on this slide. Next slide. This is the target population per district. We are looking at Joburg, which is 3.7 million people, Tshwane 2.5 million, Ekurhuleni 2.6, Sedibeng 674, and West Rand is 761. This is just to show you in terms of the number of the population size, and to also guide us in terms of the allocation of resources when you're doing the vaccination. Next slide. This is the private sector target population, which they didn't break it down into districts. They just break it down in terms of staff categories. Hospitals are looking at 61,638, which is the highest population, followed by GPs at 10.8, followed by pharmacists at 16,482, and then followed by GPs at so the total population in the private sector is 129,496. Next slide. So this is the allocation by National Department of Health. Number of employees in the private sector is 129,496. They're getting 130,000 doses for the first dose. Public sector is 81,907, and we are getting doses of 85,500. The public sector employee include all Gauteng Department of Health employees. However, it does exclude the following: municipal healthcare workers and non-personal employees at the facilities. Next slide. This is a stakeholder mapping, because this is a multi-sectoral project. We need to engage with a lot of stakeholders, like business, trade unions, people in the tourism industry, and all other departments, and the mining sector also, because they will be involved, because we'll need to vaccinate their people at their places of work. Next slide. These are the supply chain timelines from national. The vaccines came in on the 1st of February. They arrived at customs on the 2nd. They were taken to the warehouse in Midrand. On the 3rd, they will be sent to a national laboratory in Bloemfontein, and it will be tested there. And finally, the vaccines will be received by the different distribution sites in the entire country by the 9th, and the vaccination program will start on the 10th. Next slide. This is the vaccine rollout timeline. We started on the 30th of January, when we determined the number of healthcare workers and vaccination sites identified, verified the total of vaccinators. We determined districts and facilities readiness for the rollout. On the 2nd of February, there was training on the master facility listing system and approval for the implementation plan validation and vaccination sites simulation at 33 sites. It happened today. And stakeholder engagement and vaccine site validation per district is going to happen tomorrow. And validation of PHCs, CHCs is going to happen on Friday. And the 5th to the 13th of February, we're going to develop demand plan and procure ICT and other consumables for use, especially in PHC facilities. And on the 9th of February, we're going to receive the vaccines. On the 10th, we're going to launch the vaccine at Chris Hani Baragwanath Hospital. And then on the week of the 15th, we're going to introduce another 9 hospitals to be included in the rollout, because we want to learn some lessons from the launch of Chris Hani, so that we are able to, those lessons that we have learned, we can be able to implement them in the other sites. And then on the 22nd, we're gonna do all the hospitals. And then from now on the 6th of March, we're gonna roll it out to the PHC facilities. Next slide. These are the registered vaccination sites per district. In terms of Tshwane, it has 70 PHC facilities with 11 hospitals as vaccination sites. So it has 81 vaccination sites, and it has 298 vaccinators. And City of Joburg has got 85 vaccination sites with 330 vaccinators. Ekurhuleni, it has 33 vaccination sites with 99 vaccinators. Sidibeng, 14 vaccination sites with 31 vaccinators. And Westland, 11 vaccination sites with 50 vaccinators. So in total, we've got 224 vaccination sites and 808 vaccinators. Next slide. These are the schedules for the first dose administration. So on the 10th, we are launching at Bara, and then incrementally launch at all 10 hospital sites. And then on the 22nd, we are launching the 23 remaining hospital sites. which will do their first dose. On the 6th of March, we're doing the first dose vaccination by the PHC facilities. On the 8th of March, we're starting with the second dose for hospital sites. On the 11th of March, will be communicated with the cooler boxes and ice packs for the at the hospital. The distance to be traveled from pharmacy to the vaccination sites is very short in minutes, and therefore cold chain requirements at hospitals will vastly differ from the distribution requirements at district level or to PHC facilities. So in terms of hospital site, we do not have challenges. There are minor challenges which we'll be able to address before the rollout. Cold chain monitoring in the hospital. The vaccine will need to be stored at a temperature that is between 2 and 8 degrees. Therefore, temperature monitoring is therefore critical in the maintenance of the effectiveness of the vaccine, as little information is available in terms of how to deal with temperature that is below or above 8 degrees, which might lead to vaccine wastage. So temperature monitoring is very critical in this particular instance, to make sure that even at night you can get an SMS that there's a variation in terms of the temperature, and corrective measures can be taken. Majority of our pharmacists are still using the old method of checking the temperature, which is in the morning and the afternoon, which is also a good thing. We can still use it. It doesn't stop us from doing the rollout. Next slide. Security of vaccines. The vaccines will be transported by BioVac to the distribution sites, which will be escorted by security and SAPs. So security is guaranteed from national side, from the BioVac, from the distribution company to our distribution sites, and the transport that we'll be using as a tracking device that will be able to monitor where the truck is at all times. And vaccines will be stored in the pharmacy, which have security and fitted with an alarm system. Discussion, like I said, we met today with the Prof Joint to discuss the security plan, and they've indicated that they need some information that we must supply to them so that they can come up with a security plan and assist us in the transportation and the safeguarding of the vaccines during transit. Next slide. This is a summary of priorities and timelines on that today, which was a simulation across all vaccination sites and CHC facilities, which has been done. The 5th to the 6th of February, finalization of the cold chain pharmacy survey, creation of accounts for vaccinators on the EVDS system, and development of security plan. The 8th February is finalized training on the EVDS, and the February to March is recruitment of that data capturers from national database of trained data capturers and SAHPRA million program, recruitment of clinical observers for adverse events, and we'll be sourcing additional ICT hardware for PHC facilities. Next slide. These are the progress that has been made by the working groups in order to make sure that this project is a success. We have formed the different work groups and have their leads in second in charge by the different work groups, and to be consolidated for submission to the PMDCC on the 1st of February, which has been done, and also it has been done on the PCCC as well. In terms of identification of target populations, we have implemented the implementation plan has been developed. Target populations for the different phases have been identified. And service delivery platforms and vaccination site readiness, a total of 224 vaccination sites have been identified with a total of 808 vaccinators in the public sector, and still awaiting information from private sector. In training as well, vaccinators and curators have been trained. Vaccine cold chain supply, logistics and infrastructure. List of distribution sites for the vaccines has been submitted to NDOH and have been linked to vaccination sites in order to determine the total number of vaccines to be supplied to the province. An implementation plan has been developed. Next slide. And this is just a continuation of the different working groups. Next slide. So these are the next steps for phase 2 and phase 3. From the 3rd of January till the 15th of February is finalization and approval of target populations and prioritization model for phase 2 and phase 3. On the 22nd of February, develop detailed plan for phase 2 rollout. 1st of March, human resource for vaccine administration and surveillance infrastructure. Additional vaccine sites readiness, both public and private. On the 8th of March is cold chain and logistics to sort those ones out. On the 15th of March is presentation of the approved national security plan. And the 15th of April is commencement of phase 2 vaccination for plus minus 5 million people. Next slide. And that's the end of the presentation, and thank you.
Thank you to the two presenters. Is that all, MEC Dr. Mkhedi?
Thank you very much, Chair. That will be all from Gauteng.
Okay. May I prepare you that when you come back, you will have to assist us to understand. Some of the portfolio committee members visited one of your hospitals, Tembisa Hospital, last week because of an incident that took place there. We would like to be appraised by you what is the progress on trying to assist there. It may not be complete because I still have to write to you and indicate what actually were some of our findings there, which I can't exhaust them here now. We will now be engaging with you from honorable members, and the members that are going to ask are in this order. Members, please follow one another so that I don't come in between in this order. The first one will be Honorable Ismail, number 2, Honorable Kela, 3, Honorable Van Staden, 4, Honorable Chirwa, 5, Honorable Kwahube, 6, Honorable Wilson, 7, Honorable Dr. Tembekwayo, and 8, Honorable Dr. Jacobs. Honorable members, we will still want to remind you that this program is live, and therefore, at the time you are making your input, please have your camera with you on, unless you are experiencing serious challenges in terms of networking. We will then understand. But maybe you can just show your face for 5 seconds and then move out if you're having a challenge. Thank you. Let's start in that order. Thanks.
Thank you, Chair. Good afternoon, everybody, and thank you for the presentation. I have a variety of questions. Firstly, please can the department provide a full report on oxygen supply in the province? Please provide a report on the Anglo Gold Ashanti Hospital. How much money was spent already on this hospital? How many COVID-19 patients have thus been treated at this hospital? With a plus minus 1.5 billion rands allocated for infrastructure upgrades, please can the department advise what has been done and what still needs to be done and how much money is still left? Please can we be provided with a full and detailed report on all money spent on the upgrade of all health infrastructure facilities related to COVID-19? Another question here is, please provide a full breakdown of where and which health facilities the Cuban doctors have been placed, and has contracts been signed by each Cuban doctor, and the estimated monthly total cost for each Cuban doctor. Will you please provide a full details of the vaccination sites which you've elaborated on? We would like the exact name and address of each site, please. If you can't provide it now, maybe you could send it to us later. What is the percentage of current vacant posts in this province. In social media reports, the former Chief Financial Officer of Gauteng Health claimed that she received instructions from the Office of the Premier, from the Office of the former Health MEC, Dr. Bandile Masuku, and from the former Head of Department, Professor Makululi Lukele, to allegedly award PPE tenders to certain companies of their choice. Could we possibly get a report back on exactly where the investigations are presently, and if possible, the tenders that were awarded by this department? With regard to the damning report by the Health Ombudsman on the death of Mr. Shonisani Luthole at the Tembisa Hospital, I think the chairperson just commented on it now. Whether you prefer to answer the question now or maybe when you come back or in preparation for it, we find this really shocking and reveals a failure at every level. Denial of food for more than 4 days, poor record keeping, falsified information, and general negligence that really contributed to his death. I mean, the family wasn't even notified that he tested positive for COVID-19. You know, it's really shocking. What is the department going to do to ensure that this doesn't happen to any other patient at the Tembisa Hospital or any other, hospital for that matter? Also, who is going to be held to account for what happened there? You know, one has to ask the question, on what basis was Tembisa Hospital identified and designated for COVID-19 patients? Just another follow-up question on the issues what was raised on the slides. Please advise why municipal health workers are not included in the vaccine rollout plan. And how many people do you plan to vaccinate in a day? You've given us a quite thorough presentation, but it's, we're looking at large numbers, and we would like to know what is your plan per day? What's the aim of the department per day? And lastly, how many intern doctors are currently working at each hospital? And have these interns been paid? Thank you.
Thank you very much, Chairperson. Thank you very much, Chairperson. Let me also welcome the presentation from Gauteng Province, and also let me also congratulate the new appointed MEC, Dr. Thembi Mokgethi, as the MEC for Health in Gauteng Province. Chairperson, most of the questions are being raised by the previous speaker, but I'm going to just ask 2 questions. The first one, Chair, I want to check with the Gauteng Province. Has the department received any donation? If so, what are they, and also if they can share with us as a portfolio. And also the other issue, it's an issue of the shortage of staff. I'm happy that they have also highlighted in their presentation the working relationship with the nursing agency, but we want to check because we know that healthcare workers are so exhausted, and some of them are also infected by COVID. Some of them are still on the isolation. If they can just share with us so that at least we know if they have experienced those challenges, because in other provinces that was a serious challenge of a shortage of staff. The other issue, it's an issue of the other issue, Chair, it's an issue of the department, if they can just explain the prevention strategy, as we know that Gauteng was also identified as a hotspot, and also we have 2 districts in Gauteng. If they can just share with us regarding that. And then the issue of a vaccine rollout strategy, it's very good. We also welcome their strategy and also the communication strategy or the plan that as we are residing in Gauteng, we've seen the good work that they are doing in terms of making sure that they spread the communication, they talk to the community of Gauteng and warn them about this virus, which we really appreciate that even in the rural area, people are able to reach the information because really they are working very hard. And we are really happy as a department for their commitment because really we have seen many things that are happening and they are respond. And also the issue of EMS, I must say, MEC, we really appreciate the response time from the EMS. As you know that the COVID, it's happening and most of the people, they have a problem of a short breath when they are having experience of this COVID-19, but the response time, I must really appreciate. They are responding on time, they are so quick, which we really appreciate the good work that the Department of Gauteng is doing in the province. And also the other issue, I must applaud and say thanks to Gauteng team. We know that there was a flood in Ratong Hospital, and really the response also was very good. You acted immediately, everything was sorted on time, and also patients were very happy the way you have handled the matter together with Mogale City local municipality. We really appreciate MEC, the good work that you are doing. And we have a confidence that you will continue doing the good work to save the life of our people, to save the life of the community of Gauteng at large. Thank you very much for your commitment. Keep it up, the good work that you are doing. Thank you very much.
Thank you, Honorable Chairperson, and welcome to the new MEC of Health in Gauteng. Congratulations on your new post, and you're going to have a difficult time in Gauteng regarding your new post. Honorable Chairperson, let's begin at the most difficult one, and you've mentioned the Tembisa Hospital, but the Tembisa Hospital is not the only hospital with big problems in Gauteng. As a former member of the Gauteng legislature myself, problems with clinics and hospitals in Gauteng is coming from a very long time. It's constant in the media. And I want to know from the MEC, what plans is she, new plans is she putting on the table as the MEC of Health in Gauteng to stop all of these problems and to see to it that patients get the care they do need at hospitals and that they are not neglected without food or chained to beds and so forth, like we've seen the previous past year in the media happening in the facilities in Gauteng. Gauteng is a big problem for me. There's constant problems there, and the previous MECs was charged with corruption. We know what happened with a life is a many tragedy, and so forth and so forth. And there were many investigations done by the Gauteng government, but nothing seems to happen. So I want to know from the MEC, what new plans will she put on the table to eradicate all these problems in Gauteng and to turn the health system in Gauteng around to be one of the top health systems that we can have in the country. On the vaccine rollout plan.
Honorable Van Staden,
yes,
sorry to interrupt you. I would forget, the MEC, the former MEC has not been charged with corruption.
No, I was speaking about Kodari Mashlango, Chairperson. On the life is a domain. I said previous MECs. I didn't mention what MEC.
Okay.
So, all right. On the vaccine rollout, the plans you put on table looks very nice, but the answers we are looking for, what you have shown us this afternoon, is not very clear to us. Can you just explain to us by what date are you expecting to vaccinate the 10 million citizens of Gauteng? Will it by October, November, December, January next year? And also, by what date do you expect to vaccinate the 129,000 healthcare workers in the province? And then I think we need some information. I was asking this for all the other provinces. We need a report on the total admissions per hospital. Currently, we need a report on the bed capacity per hospital for high care, ICU, and the general wards. We need the mortuary capacity per mortuary in your province. We need a report of the oxygen capacity per hospital and clinic in Gauteng. And when you're speaking about the Nasrec Field Hospital, I understand that is currently the only field hospital that is left in the province. My question is, why did you get rid of the other field hospitals while you know that the second wave was coming, and we are expecting a third and a fourth wave as well? The cost implication of that, it's going to be huge. So why have you already get rid of field hospitals in the northern parts of Gauteng, the east and the west and southern parts, and you only keep the Nasrec Hospital? What was the reason for that? And do you have a backlog in your province with the issuing of death certificates at your hospitals? And just leave with me. And I want to know, can we have a report on what is the shortage of doctors and nurses and healthcare workers per hospital and clinic in Gauteng? And I want to, can we get a report on what is the status of new interns for 2021 in Gauteng, and what is the statuses of PPEs per hospital in Gauteng? Do you have any backlogs and laboratory testing? If so, what is the latest number, and with how many days or weeks are you behind? And yeah, that's all from me, Chairperson. Thank you very much.
Thank you, Chairperson. I also have a few questions here. I think first and foremost, it seems there is no sense of urgency from the province in regards to the status of healthcare in Gauteng in particular. There's more than enough evidence that alludes to the fact that we don't even have a health system in Gauteng. It has collapsed completely. We have even gone beyond of being just curative. The preventative side and the primary obligation of the Department of Health is not facilitated properly in the province. This from clinics to your hospitals, the issue of being overcrowded and all of those things that we know are the primary situation and circumstances in our hospitals. It's as if there is no sense of urgency from the province to address these things, or to at least devise plans around resolving these issues. So firstly, I want to know on why you as a province allude to the reason that people are not going to the field hospital in Nasrec. I, for one, can tell you this. It is because you have not done information distribution in the Gauteng province. People do not know. People in Mandela Park do not know that when they have COVID, they can call Nasrec and an ambulance can come and fetch them and they isolate at Nasrec. People in Mamelodi do not know of this information. People in Esteras don't know of this information because you have not done the work of ensuring that each and every person in Gauteng, in our townships, in informal settlements, for lack of a better word, are aware that they do not have to isolate at home if they don't have the necessary equipment, or if they are too squashed in, like the reality of many people, especially in Tshwane and Ekurhule, and there's many informal settlements there, and there is a footprint of COVID even there. But the people are not coming to Nasrec, particularly from these areas, alludes to the fact that we have not done the groundwork of ensuring that they know that there's a field hospital that they can go to, whether they have severe symptoms or not. Because there's also a misconception that field hospitals are for people who are really sick, and that is not the fact. A field hospital, anybody who has tested positive to COVID, who does not have a place to stay, or who shares their immediate space with too many people, or can't isolate in a room alone, must be able to access a field hospital. You have not done sufficient work on this. And please let us know how you plan, not even plan, let us know on how you will go about ensuring that everybody in Tshwane is aware of this information, and everybody in Kuruleni and all the other regions and districts are aware of this information at ground level. And secondly, I want to know how many temporary workers have been employed in the province since the beginning of COVID, and when they will all be permanently employed by the province. And also, many hospitals that I've done oversight at have cited the issue of community healthcare workers as being one of their primary or major problems in the province in regards to facilitating home-based care and extra assistance in clinics. What will be done to resolve this crisis and ensure that more community healthcare workers are absorbed? And how many will be absorbed by the province? What is the plan in regards to ensuring that community health workers are absorbed by the system in the province? And another issue, and I've raised this with the acting HOD Arnold Molotana, of a young girl who was a radio presenter, and then she got cancer, and then she was getting treatment at Calaphone. However, when it got advanced, or when it got to a point where they could not handle it, they told her that they can't treat her anymore. She must go to a private hospital. This was the information she was getting for over 6 months, going to fetch pain medication, going back home. And only after our intervention, you guys then sent her to Steve Biko Hospital, but it was too late because she sadly passed on. I spoke again to the CEO of Gauteng, the HOD of Gauteng, and it seems once again that you guys want things in the news before you act and do your responsibility. Why do you want to be chased behind with an issue of negligence that is clearly at your feet? You're aware, the HOD is aware, the province is aware, but you're waiting for an outcry from the family. Why do you have to be pushed to do your jobs? Why? Why should there be court orders? Why should you be begged to do your jobs? Each and every day, cases of negligence are reported in our offices as public representatives. We report them back to you guys, but you do nothing. You do nothing until there is a threat or until there's an article on media. In simple ways. People die. They go to your facilities to get healed, but they come back in body bags. You feel no shame in regards to that. Absolutely no shame that a young 25-year-old girl has been going to your health facility for 6 months. You know very well that you are not able to provide a service that is at tertiary level. You don't transfer to Steve Biko Academic Hospital. You wait. And then even then, when it's too late, when we tell you what is the outcome of that, you still want to wait. You want to be dragged once again. I kindly ask for the MEC to really resolve this issue, because we can't be begging you guys to do your jobs. You know what happens after negligence issues being reported. You know the investigation is supposed to happen. Why must we always beg you? And also, I want to know, I can gladly give you the contact details of the woman in question if you can ask. Her name is Sophie Pataki, but the acting HOD is the person I've been in contact with regarding this issue for the past month now. And also, I want to know where the vaccination sites across the province are. If we can get like a detailed written breakdown of all of them electronically sent to us, that would be great. And also, my concern is that there is no science around your rollout strategy in regards to phase 2 and phase 3. What is the criteria that is being used in how many doses you will roll out in a community? Because many things inform and make part of a response to a pandemic, right? Age, race, geography, social cultures, economic status. How do you then maintain the quest for health justice in Gauteng in this regard if there is no science around it? Just dates. I think we should go beyond just giving dates and give how you are ensuring that you are responding to this pandemic adequately and properly, scientifically so, using all the tools at your disposal, even those the ones that you don't want to share with us, like for example, race, how that must then inform your rollout strategy as well, and not just dates. You probably picked this up, the issue of dates, from the other meetings we had with other provinces, but that's because their presentations were also very ludicrous, like the one you're giving us, because there is no science. You are telling us about phase 2 and phase 3, but there's absolutely no science to the response that you're giving us. Or what you are planning to do. We don't know these communities that you're planning to roll out, how many people or where they stay, why that is the case. Even though there's information like hotspots, risk areas, and all of those things, we don't know your response strategy to the taxi rank issue and it being a primary concern for the spread of COVID, and how those people in those communities get to access vaccination in phases 2 and 3. Because according to your target for this year, it's actually very high. So it needs a proper science behind that, because then what we'll end up with is people who are not even living in hotspots getting vaccination before those who are living in hotspots, because there's no science to your response. And also, I would like an update on the gateway clinic that was requested by. Actually, I'll follow up on this one separately. There is also the issue of vaccination misinformation that is happening in your province right now. It was brought to our attention that there's even posters in Gauteng of people who are saying they will vaccinate people for COVID. What is the response of the province in regards to that? How do you plan to regulate the issue of fake vaccines? How do you plan to regulate the issue of misinformation around vaccinations? How do you plan on educating people at ground level on the importance of vaccination, how they can access it, that they can register for it, especially because majority of this process is even digital. People don't know about this. They don't have the link. They don't have the information because, once again, you've not done the job of ensuring that people know that they even have to register for a vaccination. As a province, there's no press statement from your side. There's no interviews. There's no media collaboration to ensuring that people know that they have to register for a vaccine. Thank you, Chairperson.
Honorable Kwahube.
Thank you, Chairperson, and thank you to the MEC and her team. I'm aware that this is the first time that we are having the MEC meeting with us, and so I would like to formally welcome the MEC and congratulate her on her appointment. You know, it obviously does come, your appointment does come at a difficult time in the Department of Health in Gauteng, and that's where I would like to start, MEC, because obviously the issue around the PPE corruption scandal is not limited to individuals, but it is clearly an insidious culture that has been allowed to fester in the department. And so while politically there may be seen to be action taken on the former MEC or whoever else, the reality is that there is a culture in your department, or at least the department that you've inherited, that is deeply worrying. And we are looking at billions and billions of public money which have been unaccounted for. So I really would like you to spend some time on, you know, having really gotten and inherited this department, what actions have you done since your appointment in cleaning out the rot of corruption? Because, as I said, it's very clear that this is not just limited to individuals, but this is a culture within your own department. In the middle of a pandemic, MEC, the last thing we can afford to have is to have a department that is leaking like a sieve and public money is literally being lost to corruption. Then moving on to my second question, you spoke about the NDOH and how they're handling a number of the aspects of your vaccine plan. Now, what I would like to know, we know obviously that NDOH is handling the acquisition side of the vaccine, but each province is going to be expected to fund the associated logistics. Now, MEC and your team, I just want to bring your attention to the number of logistical sort of gaps that I've picked up on your presentation. The one is, you know, the initial sites which have been identified, or the initial hospitals which have been identified, are 7, which I'm assuming these are going to be the nodes from which the vaccination sites are going to be supplied. But my deep concern here is that as you said, your primary healthcare facilities are only going to be onboarded with the process of vaccination in March only. And here's my concern. Generally, hospitals are in urbanized areas and primary healthcare facilities are generally much closer to people. So the concern also then is, if you're only getting your primary healthcare facilities on board later on in March, that means then automatically the healthcare workers who work at primary healthcare facilities are at a disadvantage. And so I want to understand why that is the case. And if the case is because there has been infrastructure gaps, because you spoke about the challenge of cold storage where primary healthcare facilities are concerned, then what assurances do we have that between now, which is the beginning of February, and the beginning of March, you would have sorted out all cold storage issues, you would have sorted out the issues around ICT infrastructure, because obviously the database from which every single healthcare worker needs to be attached is something that needs to be connected at every single facility, because it's a huge ICT undertaking. And so is there a plan to capacitate these primary healthcare facilities between now and then? If so, how far are you? Because in my view, this need not wait for the vaccine to be in circulation. This is something, MEC, that could start to happen, and that should have, quite frankly, started to happen even last year, because we would have known that a vaccine would need to be rolled out at some point. So I would like to understand, how does these infrastructure gaps fit in with your budgeting process? Is there money to be able to fund these gaps that you've identified yourselves? And if so, what are we looking at? Where are we looking at sourcing this money? Because it's obviously not coming from the National Department of Health. Then my last sort of theme of the questions is around the 808 vaccinators that you spoke of. Where are they coming from? Are they from existing staff members, or are these additional staff members which have been recruited? And then lastly, just as a point of clarity, MEC, the allocation that Gauteng is getting for both the public and the private healthcare sector, what is the strategy that the province is going to be using? Are you going to be rolling out that allocation to all your healthcare workers as the first dose and wait for the second dose to be acquired and brought into the country? Or are you going to be dividing your entire allocation into two so that you can have a first and a second dose? Because then my concern is, if the second dose doesn't arrive in the time that it is effective to take a second booster shot, what is your plan? Because ultimately, then those vaccinations could have gone to waste if we don't get the second batch of our vaccines within the time that is needed, which is, from what I can understand, is about 26 days to about 3 weeks. So please, could you clarify how the province then will be handling that? Thank you very much.
Thank you, Chairperson. And thank you to the MEC and her colleagues for the presentation. Welcome to the MEC. I don't think I really fancy being in your shoes just at the moment. You have joined, as my colleague ahead of me said, at a very chaotic time with regard to the Department of Health and Gauteng. I think my questions have been covered by a lot of my colleagues ahead of me, but there are a few things that I would like to address. The first thing I'd like to address is the EMS capacity of your ambulance capacity, etc., in Gauteng. According to information and a response to a written question to the minister, the ambulances in Gauteng region are expected, some of them, to cover an area of between 14,000 kilometers, right up to 41,000 square kilometers, which is, with all due respect, an absolutely monumentally huge challenge for anybody, and particularly when we're in the middle of a pandemic and ambulances are having to queue outside hospitals to offload patients while they're being triaged, etc. And it has been a huge concern, and we have received hundreds of complaints in this regard, and hundreds, and I mean hundreds of people complaining that they call for an ambulance that never arrives. These are sick patients, some of them deteriorating quickly, and sometimes it can take up to 4 or 5 hours for an ambulance to arrive. It's disturbing, it's distressing, and it's very, very hard on the patients who are actually entitled to a better service than that. I just need clarity MEC, on your bed occupancy. You showed us a slide with various sectors, areas inside the Gauteng region, and the bed occupancy, anything from 50 to 59% bed occupancies only, which is indicative that there was a lot of available space left in your hospitals, including Nasrec, whose occupancy rate was low, and that in actual fact they had lots of capacity left. Having said that, you then, in another slide under the challenges and mitigations, said that you had insufficient functional beds. Now I'm totally confused. You've got a lot of space available, you have beds available, but you've got insufficient functional beds. Can you please explain to us what that contradiction is so that we have a better understanding of it? And on top of that, you're resourcing a further 300 beds for Jubilee AT to enable the decanting of PUIs in Gauteng North. Now, closed field hospitals, we have Nasrec only still running. We have a huge financial constraint within the department, and resources are exceptionally limited. The hospitals are seriously understaffed already, and now we're going one step further to source another 300 beds when there are actually a lot of beds still available according to your presentation. Is it necessary to be, spending money on extra resources when resources are actually available already? And would it not be easier to find a method to move people from Gauteng North into Nasrec and those hospitals that have beds available? I'm confused by the statements that they contradict each other. Maybe I have misunderstood it. I'm not saying I'm not, but I would like clarity on that. Amongst a lot of the complaints that we have got from Gauteng are retired doctors and nurses, qualified nurses who no longer are necessarily practicing, but a lot of whom are still registered with the Nursing Council. They have volunteered their service to hospitals and the Department of Health to assist in these pandemics. They are either rejected or never ever get a response. Now, we know that there is a shortage of staff. There's a shortage of medical personnel countrywide. Gauteng, probably a lot worse than some of the other areas. And yet these people who are willing to volunteer, many of whom do not expect monies in return for their services, they're just prepared to put the lives of South Africans first, have been treated in this manner. Can you give us some clarification on that situation? With regards to the vaccines, I'm not sure if I heard it correctly, that in the first phase of healthcare workers, 85,000 public healthcare workers will be vaccinated and 130 doses allocated to the private sector. Are we getting an equitable share for everybody in these vaccines and this rollout? I'm just more than anything else. And then with regards to your vaccine programs and your rollout, well, we see your presentation, we see your timelines, we see your dates, but a lot hasn't been done. And I think this was covered by my colleague, the Honorable Kwarube. ICT systems are not even in place yet. An ICT system is not a case of, I'll order a computer today, it arrives tomorrow, I'll go and plug it in. Boom, bang, there we go, the thing works. IT systems do not function like that. It's just not that simple. And yet you were about to roll out in the next 10 days, the first phase of vaccines, and those computers or those ICT systems are not even in place yet. There's infrastructure lacking. There's things that still need to be put in place. So please forgive me when I say I think you, and I suspect that you're being super overconfident. Or you're trying to impress us, and it doesn't. I think trying to meet these targets and the rollout plan that you presented to us today is not very likely. And the minister has constantly advised that there will be a 3-phase rollout of the vaccines. We know that the health workers will be done first, and then we go into the second phase with people with comorbidities, the elderly, etc., etc. And so the phases go. Now you have planned and given us dates, second phase and third phases of the vaccine rollout. The minister has yet to even advise us when the next vaccines are arriving, how many they are, when they will be arriving, and what we can expect. So well done for planning for something. You obviously have more information that we don't even have yet, and I think that is why there are the court actions in places that there are, because this information is not available to us. I would love to know if you've got information that we haven't. One of the things, and I raised this with SAHPRA, and I think it is a very serious issue, on 2 things. Number one, the tender process, in light of what's happened in the Gauteng department prior to this, that we have checks and balances, that those people, and that the tender documents that are going out, particularly for the distribution of vaccines, it's very, very clear as what is required, storage conditions, temperature conditions, all of those kind of things, because we cannot have inexperienced or unqualified people getting bids to move vaccines when they are not qualified to do so. We cannot put the larger South African population at risk under any circumstances. I think they've been through enough. And the other situation, and I raised this earlier today following news out of China, is that there they had a problem where they actually stole vials, the medical wasted vials, went and filled them with saline water, and were selling vaccines, and I say that in inverted commas, to people who were desperate. People are afraid. They want these vaccines. They want them quickly. They're scared of COVID. And unfortunately, they got saline water and not necessarily a vaccine. So I just want to know, with a degree of confidence, that there are proper things in place to ensure that the disposal and management of the vaccine wastes, the vials, and all of those kind of things are in place. I don't know if the information out of China was fake or not. I believe it is not. I believe this has happened in an area in China, but we need to be very confident that that is not going to happen in South Africa. So I thank you.
For Dr. Tembekwayo, may I check, Honorable Wilson, I wanted to check I heard you well regarding the emergency medical services challenges that sometimes is a distance of 4,000 kilometers or 41,000. I was just noting that I missed that distance that you noted on ambulances. What is that distance?
Thank you, Chair. In the response to a written question that I submitted a short while ago, we got the response a couple of months ago. Our ambulances in some areas are, and depending on the locality of those ambulances, they are expected to cover anything between a 4,000 square kilometer radius and a 41,000 square kilometer. I think in Gauteng it is about 4,000 square kilometers and 14,000 square kilometers. But the area is absolutely huge and astronomical, and I think it's something that needs to be dealt with quite quickly. I thank you, Chair.
Okay, thank you. Honorable Dr. Tembekwayo.
Thank you, Chairperson. Due to unstable connection, I won't be able to put up my video. But all the same, I have some questions to ask, though most of the questions have been exhausted by my colleagues. The first one is, please explain the plans put in place to ensure that chronic patients continue to receive medical care and treatment. But I've got another example. I'll talk about it at the end that needs the MEC or HOD's attention. And then the second question is based on the status. Please explain the status end the cost of dug up graves in Gauteng. We need to hear about that. The media reports of increase on unclaimed bodies in health facilities. Can this be confirmed? And what happens to these unclaimed bodies? Another question, excess deaths is raised as serious concern. What is being done to ensure that every death is documented accordingly? Lerato Hospital recently experienced some flooding, and everybody saw how the patients' folders were destroyed. My question is, what was that, if there is any recovery plan pertaining to the patient's folders? The files plays an important role. What is it that you did or you are doing to recover the patient's folders? Let me use this platform to say to the MEC of Health that there is a patient whose story appeared in Sowetan, who was operated on in 2016 in the Mamelodi Hospital. And she left the hospital with an open wound. This is 2021. The poor somebody is struggling. I have the pictures of the wound and it's very scary. The steel pus, oozing out of that wound. So I took it upon my soldier to contact the CEO of Mamelodi Hospital to try and schedule an appointment for him so that he can address this problem amicably. They were supposed to meet him today as per confirmed appointment at 10 o'clock. He was not there. They had to leave the hospital without being attended to by the CEO and without giving any other reason. So I'm saying to the MEC, please, can you intervene on this problem and let's spare the life of this patient? And please don't refer me back to the MEC because my intervention failed dismally too. And then I need you to promise me something when you respond about this one. I also have an old woman who is suffering from cancer, who was sent out of the hospital in 2019, and we are in 2021. The families were told not to bring her back to hospital because there's nothing that they can do. She is still alive, and they are trying the help of the doctors, which is very exorbitant, very costly to maintain her. She's still alive as we speak, but they were told that she won't live for more than 3 months, which shows the negligence, and the inhumane nature of the treatments that we get from your hospitals within the province. I also need your comment and at least an answer to say what would be your recommended way forward in connection with the 2 cases mentioned. Lastly, there are long queues, very long queues in clinics around Tshwane, and I think it's the same with Gauteng. Long queues, patients standing on queues as at 3 a.m. for them to be attended to. There is a vaccination program going to be run. How are you going to accommodate them in the locations for this vaccination rollout? And where will it be done? And I'm still saying your communication does not reach out to those poor communities that need them. Thank you.
Okay. Honorable Jacobs, Honorable Dr. Jacobs, followed by...
And thank you to the MEC and the staff from the department for the presentation. I might also switch off my camera because I will probably also have challenges with the network. I just switched it on now, and I think I would rather switch it off now. I would like to speak to 2 points here. One is the current COVID infection, and number 2 would be the vaccine rollout plan. Now, we have this impression that in one part correct, in another part not so correct, that the vaccine will just erase all of our problems. But I want us to be reminded that we're still dealing with an infection, and we need to do everything in our powers to manage and assist the patients who are infected and will be infected in the future until we get this herd immunity that we talk about. So we note in terms of the current infection in Gauteng that there's a decline in the numbers of active cases and new infections. We also note a good recovery rate of 95%. We know that continued opening of new wards for COVID-19, but I have a concern, and I want to raise the following points. And that concern is, what are the future plans of the Gauteng Department of Health with regards to continued preparation for a new resurgence? That even as it's declining, there's a possibility that there would be an incline again in the number of new infections. And number 2, the preparation for a third wave of infections. We're also noting that we're going towards winter, and the possibility really does exist that we could be faced with a third wave now. And I'd like you to maybe answer this in terms of 3 points really. The one is staff, and we are noticing the exhaustion of the staff and the fatigue of the staff, and we're also noting the passing of our staff members. So in terms of training, we should be having new training programs annually for training of nurses, for example, and other healthcare workers. If you could maybe allude to that, and if it's not possible now, that maybe you could give us a written reply with regards to that training, so that we make certain we are always ahead in terms of the staff that is required. And then in terms of increased clinical support to patients, and here I talk about any support, whether that would be medication, whether it's chronic medication, whether it's oxygen supply, whether it's the correct oxygen supply, whether it's enough numbers, beds, etc. Because we've noticed, and as I mentioned earlier, the continued opening of new wards. But the question would be, how do we maintain those wards? If there is now a decline, we need to, as opposite to what had happened in the past, we had decommissioned some temporary facilities in other provinces especially. But it would make certain we'll be able to maintain those in case we have either that new resurgence or we have a third wave. And then what are the plans to manage the sequelae of this COVID infection? I think we need to be very mindful we're going to have many people with chronic diseases after this who possibly had not had it. And that could be diabetes, but especially people with lung diseases. And we need a very special plan towards that. Then in terms of the vaccine rollout plan, I commend you that you are putting forward a plan. We understand that this is work in progress. We also understand that all of you are working under very difficult conditions, and the MEC is very new, and we also welcome you to your position. But on slide 19, your private sector, I just want to talk to slides 19 and 20. And I want to ask on your private sector target population, I recognize that has been put forward in terms of staff categories. I'm a little bit uncertain of the numbers. For example, I see almost 6,000 more pharmacists than GPs. I would assume that this would be for the different categories with their staff that they have within their offices. That's the only way that I can try to explain this to myself. And then if I take this one and I correlate that with slide 20, then I see that in the private sector, we have about a quarter more or 50% more staff in the private sector than within the public sector. And it does make me a bit worried about the number of staff that we have within our public health sector and facilities. And lastly, just to talk about that, I don't see mentioning of medical students and any other students, for example, those studying physiotherapy, occupational therapy, nurses, etc. who work within the clinical setting and certainly will be exposed to the COVID infections wherever they work. And then you have a number of universities within Gauteng, which have medical facilities or medical departments, health faculties, for example. And I'm really worried that these are not mentioned on your slides. And then very lastly, we have heard before that the Western Cape wanted to procure its own vaccine, and the minister had said that this is a national strategy. But what is your view on alternative strategy for procurement, especially noting, and the same thing that I noted, those number of doses which have been allocated seem to be for the first dose only, and what your strategy would be to ensure that the second dose is available within the 21 days or 12 to 21 days which are required for one to get that second dose. Thank you very much.
Okay. Comrade, Honorable Munyai, last hand.
Thank you very much indeed, the Honorable Chairperson. I won't be able to use the camera. I have a technical problem. First and foremost, let me welcome the fantastic presentation by the MEC of Gauteng, and the presentation give us some insight, and also key the decline of the infections of COVID-19 patients, patients or people in Gauteng. That is fantastic progress. I know the issues of procurement of vaccine, it is a national centralized program. You may not be able to speak on the control of such procurement, but to plan on what is distributed to a good selves. So the other key issue, Honorable Chairperson, I'm from Ekurhuleni, Gauteng. I know that there's been intensive communication strategy to indicate the availability of the field hospitals in Gauteng, including the Nasrec one. So the issues that try to indicate that there's no communication in Gauteng, that could be
Point of order,
misleading.
Chairperson. Point of order,
Allow me, Honorable Chairperson,
point of
to
order.
continue
Can we be
to
respected in this house? Honestly, can we be respected?
Honorable Chair.
There is a point of order, Honorable Munyai. Hold on.
We don't need his response.
Chairperson, my point of order is that Honorable Munyai is not the Gauteng Province of Health. He cannot respond on their behalf to my questions. I was not talking to him in particular, and he can't. It's a growing tendency that you need to address. I mean, the first meeting we almost collapsed because Honorable Munyai once again doesn't respect his fellow co-workers because he tries his best to defend the ANC even from the indefensible. Okay. And even if he can do that far away from us, not with our questions.
Honorable Chair.
Nothing wrong that Munyai saying. He's correct. No, he's not correct. He's not correct. He's reciting.
To say. He comes here with no questions and then he listens to what
he's not correct. He's not correct.
Honorable Kela, Honorable Dr. Tembekwayo, please keep quiet, please.
No, Gela must also not interfere.
As I was saying, Chairperson, we don't come here to give other members points to speak on. If you don't do your own research, you must come here and keep quiet instead of just lagging on top of our questions as people who work in this portfolio committee. You don't do oversight. You don't have questions. You wait for honorable. You are always the last to speak because you have nothing to say. And then you want to latch on to what Honorable Naidi Chirwa said. Then you have something to say.
He never said Honorable Chirwa. Honorable Chirwa out of order. He never mentioned your name. He never mentioned your name, Honorable Chirwa.
I don't care. I didn't say my name.
He never mentioned your name.
And I was not talking to you, Honorable Kela.
He's not responding to you. He's not responding to you.
Honorable Kela, keep quiet.
Respect yourself, ma. Respect yourself.
Honorable Chirwa, please finish off now. Let me start this way. Honorable members, let us agree that you will not respond to a question asked by another member in the platform until and unless there has been a response by the MEC or his or her delegation. Number two, Honorable Tembekwayo, when Honorable Chiro was making her point of order. You came in to support the background. That was wrong. And then Honorable Kela also came in to support, to actually cause that. That was also wrong. You were almost crowding and clouding Honorable Chirwa in her point. So please, when I have given her a platform to speak, Honorable Kela, Honorable Tembekwayo, you are out of order to come into that space and also intervene. Honorable Munyai, please, can you not go into the space of members who have asked questions? No. Let that be answered by the issue of, what were you responding on?
Communication strategy.
No.
I was speaking on the communication strategy. He didn't
Honorable
prepare,
Chairperson,
so he to jump on my question.
Honorable Chairperson.
Prepare. Do your job, Wena. Do your job instead of jumping on top of our questions. Come
Honorable Chairperson.
Be innovative.
Honorable Chairperson.
How?
Point of order, Chair. Can we put a stop to this behavior?
Honorable Chair, I don't stay in Mamelodi Township. I stay in Nekur Lane. Allow me to...
Precisely my point. Prepare your own questions. Stop jumping on my questions.
Honorable Chair.
An extension of my questions.
Yes. Point of order.
Find your own questions. Come up with your own questions. That's it.
Honorable Chair.
Don't respond to mine. I don't work for you. I don't work for you. You're a colleague. You're not a supervisor. There's no supervisor.
Honorable Chair.
Don't act like supervisor.
No. Honorable Chair. I don't represent the EFF. I represent the ANC. So leave my party. Leave my party alone. Leave my party. Leave my party alone.
Honorable Munyai, hold on. I'm not called you to speak.
Don't take my questions and then want to respond to my questions. Go to your own research for your own ANC.
Honorable Chirwa, please, you have made your point.
What were you going to ask if I did not speak? What were you going to say? You had nothing to say. You came in empty. That's why you are the last person to speak, because you came here empty. You don't have anything to say. You have nothing to provide to the community. That's why you are the last one to speak. Respect me, I will respect you back.
To assist me to mute Chirwa. Honorable Chirwa, you must keep quiet when I ask you to speak. You have spoken and you have made your point. Now we are continuously with the chorus. Please keep quiet. Honorable Munyai, when you address your points, please don't make reference to what was said by another member. Just make your point, please, Chair. Please, sir. Can you give you now the space to speak?
No, I'll continue to speak for my party that brought me here. The ANC Gauteng province. It is the best province in terms of the healthcare system, like not any other province in the Republic. So therefore, the presentation by MEC, newly appointed MEC, it is very fantastic. It reflects the objective reality for Gauteng. Therefore, my question that I want to raise, which I know it is not part of the MEC delegation, is that, Honorable MEC, do you think the issue of vaccine being centralized by national government, do you think it will be conducted by unitary government or by federal government? Because in South Africa, we don't have federal government. If you can clarify that point. The second point is that you are a leader of Gauteng in government, Gauteng provincial government in healthcare system. Can you please raise the good points in your response out of your own presentation with respect to the progress you have made in attending to issues of the healthcare, amongst others in service of the patient and also in issues of the COVID-19. Lastly, Honorable MEC, through the chairperson, also reply only to the question that would have been guided by the chair as part of your presentation. The rest, I know you are the best, simple the best. I can't even ask any other further question. You have availability of oxygen. You have really the field hospital than any other any other province in the country. And thank you very much for being the excellent healthcare system in Gauteng, in the country. Thank you.
You have nothing to say because you don't have questions. You don't have.
Honorable Chief, your space. Okay. Honorable Keller, please don't come in now. Please, the two of you are not being asked to speak. Honorable MEC, I was not aware that members are going to be giving you this hard time, being a new MEC in this portfolio, but I welcome you, and I thought they were going to be very kind to you because you are a new MEC. Nevertheless, take that and answer as much as you can. May I just add the following questions? What is the category of healthcare professionals you call vaccinators? I would imagine you don't spend too much time training such category of South Africans, healthcare professionals, because it's not the first time we have a vaccination program in the country. It may as well be a new vaccine called COVID-19 one, but vaccinations is something that is also always done in clinics and all that. I am very concerned when you are raising an issue that says you are going to consider nursing agencies to assist you with staffing, when there's a lot of other directly, when you can actually employ directly from the community and put an advert. Why do you have to rely on the nursing agencies? And then 2 years ago, all provinces were supported by what we call a presidential stimulus package to improve and increase their pool of staff members. Has that not had an impact in Gauteng in terms of getting more and more healthcare professionals to support you there? I'm worried about the statement that was made with regards to, of the 7 hospitals, 3 out of 7 have got the temperature monitoring system that is in place. Now, in that sentence, you did not indicate when are these other 4 going to get such a temperature monitoring system in place, because we might as well one day report that 800,000 vaccine vials that were in wet fridge has now since been discarded, because so please just give us a timeline. When are you going to get those ones checked up or repaired? My last is with regards to Tembisa Hospital. I did prepare you to comment on it. The biggest challenge in that hospital is that you rightfully declared, not you, but your predecessors, they rightfully declared that hospital a tertiary hospital, meaning that it is a big hospital that can actually have specialists and all such levels of disciplines, because it is servicing a very large population in Ekurhuleni. That was a good decision. However, the resources that were to be put in place to make the hospital really look like a tertiary hospital, we are found wanting there. Now, we wanted to check, because you can do as much as you can in disciplining people there, but if you do not provide enough, improve on infrastructure, probably there's been some improvement on infrastructure, but improving the HR, improving the nurses on the floor, the nurses on the ground, improving the equipment there to make it a level of a tertiary hospital, then you would not have probably a lot to support, to blame whoever was there not to be able to resuscitate this and that. Please, if you are able to comment on that, I would like to hear it now. But if you cannot, I would be happy to engage with you and get responses later on. May I then give you this opportunity to start presenting, responding, and with your.
Thank you very much, Honorable Chairperson, and thank you very much, honorable members, for the questions. Chair, maybe just to indicate that the acting HOD has also joined the meeting, and all of us are going to share the responsibility of responding to these questions. If you allow me, Chair, I will come in at the end. Let me allow my team to respond. Then I will come at the end and add where they did not responded. And the one for Tembisa, I will respond to you, Chair, thoroughly after they have responded. Acting HOD, if you are in the meeting, you go first, and then Mrs. Lerutla, and then Mr. Malele on the rollout. Thank you very much, Chair.
No, thanks, MEC, and thanks, honourable members, for the questions and the comments. I'll try and answer as many of the questions as possible. My name is Lisiba Malotana. I'm the acting HOD for health, and I was at the meeting when Ms. Lerutla started the presentation, so I got context and some of the issues. I think the issues that maybe that relates to matters of investigations and others, I'll defer them to the MEC. I'll deal with mostly technical and operational issues that were raised. Maybe just to touch a bit about Tembisa, because there's been a common thread, including the last question by the chair. Maybe safe to say that we as a province, the MEC has also accepted.
Mr. Molotana, can you keep your camera on if it is possible? If we have a challenge to do that, so that we can continuously see you while you are making our input. Then.
Okay, that's fine, Chair. I thought it interferes with the connectivity, but it's fine. I'm happy to do that. Maybe, Chair, to agree with you that part of Tembisa's as a tertiary hospital, some of the issues are a bit systemic, and hence, as a department, we have taken a posture not to appeal the ombudsperson's report, and with the view of that, we're going to use the report to deal with some of the systemic issues, and maybe, Chair, to confirm that part of our recommendations includes the systemic improvements that needs to be done, one from an infrastructure point of view, the health technology point of view, ICT in terms of the record and management of patients, but also to part of the biggest business case we are making now is to ensure that Tembisa is sufficiently funded for the tertiary services it intends to do. Also, bearing in mind, Chair, that Tembisa does not have any referral facility within its immediate radius, and it refers to Steve Biko, which is the other part of town, and hence the issue of our intention to as a matter of agency to get the Kempton Park Tembisa Hospital on board as part of relieving the pressure there. There was a question that talks to the issues about donations. Chair, I can confirm that we've received donations from as far back as March to date, and maybe to declare that the value of the donations we've received are just under $500 million, and those have been declared to the provincial treasury as a requirement. The range of donation, as it was asked, it was what were the donations. Most of them were, of course, contributing to PPE in various categories. And I think if the committee wants that breakdown, Chair, just to avoid misrepresentation, I could just avail that detailed report as declared to provincial treasury. But most of those items were PPE-related, sanitizers, coveralls, and equipment. Of course, there's a bulk of equipment that we received from the USA government and US aid, including especially ventilators at the beginning of COVID. But that detail I'm happy to share without necessarily quoting. But the donation, as I said, Chair, they exceeded. We are within the range of $500 million. In terms of the staff, I'll deal with issues of staff the way they were asked. Chair, I think it's easier. I'm happy to concede and confirm that COVID has taken a toll on our staff. We are noticing three elements, and I think Member Jacobs in his questions asked for specificity. that before COVID and where we are now, we have over 4,000 staff that were brought in on board. So for the purpose of dealing with issues about legacy, the beds that were activated before COVID, we will have more beds and we'll have more staff than before COVID. And Chair, just to confirm that the approach to COVID in Gauteng from the inception was that we're always going to repurpose, renovate, renew our infrastructure, and then where possible, we'll then of course build within the current infrastructure so that we have legacy. And thirdly, we will do ABT, alternative technology, which is what we've done. And thirdly, we'll then do field hospital because field hospitals are not part of the legacy, and that has been the approach to the response. But maybe to combine issues that relate to staff, our staff is fatigued. Our infection rates, I think we've presented here in terms of the numbers we've reached, but also what we've noticed that there's quite a very protracted recovery rate. The staff takes long to come back to normal post-infections, and something we are managing, but also we are managing staff that is also anxious, and we enhance the extension of the psychosocial support that we have in the province, but also the health support forums that the staff through in the department have put in as just part of supporting and management of the staff. As far as relates to emergency medical services, there were specific questions that related to that. Luckily, from a geographical point of view, our distance to patient is not as far as in other provinces like the Northern Cape and others. However, we have an issues about concentrations and volume as far as relates to emergency medical services. But one of the greatest thing Chair could say that we have over the past 3 years recapitalized emergency medical services, and we have procured over 3,000 ambulances as part of just addressing the population demand, but also to try and dispose of course, aging fleet, given the regulations about the mileage that our ambulances need to maintain. We have recently completed the provincialization of EMS across the province. As you know, Chair, that it was the only province where there was an agency model that we're using. And in that process, of course, there are teething problems as to getting the public to understand that the service has moved somewhere else and the coordination of that. But in terms of the call volume, Chair, it's safe to say that year on year, in terms of statistics, our call volume has increased by more than 100% year on year. And that really has got huge bearing. Even during the lockdown, our service demands, of course, for inter-facility transfer and others remain quite high. As far as relates to maybe just to deal with Nasrec as a principle, Nasrec was intended as a field hospital, but also was supposed to, of course, to be used for stable, what we call PUIs, persons under investigations. And maybe just to deal partially with part of the member Chiro's question, is that we as a province have issued and communicated the admission criteria and the need for a free access to Nasrec for both quarantine, isolation, and referral as a down referral from our facility for stable PUIs. Chair, maybe just to explain why is there such a low occupancy rate at Nasrec? And this is something that we had to go look back at the data, that during the first wave, Chair, we had more than 4 quarantine and isolation beds in the provinces, where we had Eskom, Telkom, and other parastatal that had made facilities available for us. And our occupancy rate has always been at less than 10%, and hence the need to consolidate at one area, of course, from a resource point of view, cost point of view, and everything else. Nasrec, with all amenities in place, made more sense for us to consolidate everything under Nasrec. Nasrec bed occupancy currently is lower because the oxygenated beds that we've created and the PUIs that are in the facility are too sick to be down referred, and hence they are managed at the facilities that they are. There has been quite a recent uptake by Sebokeng, Kopanong, and parts of the Bara cluster. However, when we investigated why are we not able to decant as many patients of that, and the feedback from the clinicians that are dealing with that is that the type of patients and persons under investigation that we are dealing with require a higher level of care than what NASREC will provide, and that's one of the issues. Maybe, Chair, to then say what has been, there was issue about cost. So I'm safe to say that to date, from last year, and with all the beds that we have and the patients we've treated so far, we have paid 212 million on NASREC. As to the issue about a staff vacancy, I think I've dealt with it when I said we are 4,200 and just over 4,000 staff members that were not before COVID. And a bulk of that staff, of course, some of them were on the COVID contracts, and the province has recently made a pronouncement that because COVID will go beyond the current financial year, those contracts must be made permanent, and we are going through an administrative process of converting those contracts into permanent appointments. We know how much it's going to cost us, and we are waiting to go to the Premier's Budget Council.
Yeah, I think we lost the
Mr. Malo
person.
Mr.
Yes.
Malutana. Mr. Malutana, we lost you now. MEC, another leader there.
Can I request that either Ms. Lirutla or Mr. Malele to take off where the acting HOD has left, and then as he joins in, he will be given the opportunity to finish. Thank you very much, Chair.
Thank you, MEC. I will come in. I will answer to the first one, oxygen supply. Just to make honorable members aware that we are very comfortable with our oxygen supplies in the province. We have weekly meetings with AFROX, and we also have a system.
Can you see your face, Ms. AC, as you present? Gauteng is a very good and nice place for connectivity. I hope we are not going to be losing you also. Connect your speed. Thank you.
Okay. Thanks. I was not connecting because of the connectivity challenges. I hope we are not going to be affected. I was saying that with regard to oxygen, as Gauteng, we are very comfortable with the oxygen supply. We have weekly meetings with AFROX, which is the supplier of the oxygen, and we have a system. Once we get to 50% and less of the supply, AFROX comes in to refill. And we have a report which I've just asked the Secretariat to share with honorable members. And that report will show that in Gauteng, we had 4 facilities today that needed to be refilled, and 3 of them have already received, and the 3rd one will be receiving this night, tonight. And all the 4 that I'm referring to, their capacity was at about just under 50%. And I'll also talk to the issue of municipal workers in terms of the vaccination program. They have been included in all the districts on the numbers that are going to be immunized. And with regard to the testing, in Gauteng, our turnaround time for COVID tests that have been done, it's 48 hours. And we do not have challenges in terms of National Health Laboratory services in that regard. And also just to make honorable members aware that actually Gauteng, in Gauteng, this is the only province where community health workers have actually been absorbed into the permanent staff members. And also the issue of, to clarify the issue that was raised on the fact that our occupancy in terms of our hospitals, we reflected that we're not yet overflowing, but we also mentioned about a challenge when we did the challenges. I need to clarify that I mentioned at the point I was presenting that we are mentioning this as a challenge in case the numbers in future go beyond what we already have. And I think in that regard, it's also important to mention that because we would like to continue to manage the possible capacity challenges that we may experience, that is why we're continuing even with the ABT at Jubilee to ensure that these 100 beds are working. And we also mentioned that as the need arises, even in other hospitals, the repurposing of beds, it's something that the department can do. And that will be taking care of the future plans for the resurgence if necessary. And we have taken the point from Honorable Chair with regard to the issue of nursing agencies, but I need to clarify that nursing agencies, we're looking at them only as an option if there's a critical challenge at that particular time. But as a province, what we've been doing thus far, we have not taken any from the nursing agencies, we have employed directly. Thank you, Chair. I'll allow Mr. Malele to take the questions on immunization. Thank you.
Thank you, Chair. I'll respond to the questions that have been raised. The first question was how many vaccinations are we planning to do per day? If you look at the number of vaccinators, we're sitting with 808 vaccinators per day. So if everything is operational and all vaccinators are activated, because like I indicated, we are starting on the 10th of February at Chris Hani Baragwanath Hospital. And then from there, on the week of the 15th, we are increasing to the other 3 central hospitals and the tertiary hospitals, because we have never traveled this route before. We are learning, and we want to make sure that from what we will have learned through the rollout at Chris Hani Baragwanath, we can take those lessons and implement them to the next phase of hospitals that will be enrolling, to make sure that we take it forward. So if 808 vaccinators are all active, and that our plan is that one vaccinator must vaccinate 40 people per day, we're looking at about 32,300 vaccinations per day, but we're not there yet. As soon as we activate more vaccinators, there will be improvement in terms of the numbers. And in terms of total number of vaccinations to be done, which is linked to the number of vaccinations, we are planning to do all these vaccinations over a period of 12 months. Obviously, the dependency is the availability of the vaccines from the National Department of Health as to when is it available, and we are able to be allocated the quantities that we need, so that we can be able to vaccinate our people. In terms of the 85,500 doses that we have received, it's only for the first dose, so we'll be vaccinating 85,500 healthcare workers as first dose. And I think National has reserved the second doses. It's not like the second doses are not there. So the second doses will be made available after 28 days or so that they don't want us to be vaccinating a lot of people and only to find that the second doses will be a challenge. So they've reserved the second doses so far, so that we can be able to do the second doses. In terms of the reason why are we only vaccinating the healthcare workers at primary healthcare, In terms of phase 1, there are 4 categories. And the first category is people that are dealing with intubation and ventilation, and people that are dealing with a positive COVID-19, which is normally happening at healthcare facilities. And that's why we say we want to give ourselves time to be able to make sure that we vaccinate all healthcare workers at hospital level. And then from there, we'll go to clinic facilities. In terms of saying, what are we doing in terms of connectivity issues? Like we have indicated that not all PSC facilities have got connectivity issues. Like we indicated, we've got 192 primary healthcare facilities that do not have any connectivity problem. So during that process, we'll be rolling out to those 192 facilities, and then at the same time addressing the issues of connectivity in those particular facilities. Medical waste, it will be managed properly. We have a contracted service provider to deal with medical waste. Fridges that do not have monitoring devices. It's not like the temperatures in those 3 facilities are not being managed. They are being managed, but they're not using an automated electronic monitoring devices where it will give you an SMS when the temperature is below 2 degrees or when it's above 8 degrees. So there is a thermometer that is being placed in the fridge. It's being monitored twice a day or every day, and to make sure that the temperature is well maintained. So there is maintenance of those. In terms of cold storages, we are not doing vaccination for the first time. We've done it, and it's happening at primary health care level. So there are cold storage facilities in our primary healthcare facilities. And remember, when we're doing the second and the third phases, we'll be collaborating with the private sector as we are currently.
Yeah, you are disappearing from the screen. Please open your eyes and look at yourself that you are no more in the screen. Yes, now you are okay. Yeah.
Okay. Yeah, like I'm saying, in terms of the vaccination program, it's not for the first time that we're doing vaccination. We do it with the API. We are collaborating with the private sector, and we'll continue to collaborate with them going forward with this COVID-19 vaccine program to make sure that this vaccination is a success. I think I've covered every question, unless there is a question that I've missed. Thank you, Chair.
MEC, Dr. Moketi, is Mr. Molotano back?
Not yet.
Okay, then continue.
Maybe just to declare upfront, we do have challenges of a network in some parts of Gauteng, especially Midrand, where the HOD is residing. And Chair, maybe to declare, I come from the rural of the West Rand. Sometimes I also have challenges with the network, but only on Zoom. When it's Teams, normally we don't have a challenge. Maybe just to say, Chair, apologize upfront to say if we did not answer each and every question, may I request that honorable members then send those questions so that when we come, we are able to respond to that. And also to
MEC, Dr. Let's try and have you on your face. If when we fail, we'll then leave you without. But let's try and get your camera on.
Okay. Thank you, Chair. Maybe to also say thank you very much. Some of the honorable members did give us some tips as we improve our plan. We'll also make sure that we factor those in. There is an honorable member who spoke about the management of waste of the vials. How are we going to do that? I think that is a very good point. We will be able to factor it in as we finalize our plans. And coming to the issue of Tembisa, Chair, I think the HOD did mention that as Gauteng, we have taken a position to say we are not challenging the report or the recommendations of the health ombuds, simply because we are going to use it as a tool to make sure that we are addressing the gaps that are existing within the health system. And on the issue of the accreditation of Tembisa Chair to be a tertiary hospital, it's one of the issues that are in the recommendations of the ombuds, and the minister will be look into that or relook into that issue of accreditation. And what is nice about the findings and the recommendations of the ombuds is that there are findings on the structural issues, and already we have engaged the premier, and then the premier said we should compile a report, establish a task team that will go and assess what are the structural issues that we can be able to implement, and where are the funds. Maybe we also will also find the funds where we'll be able to fund the additional structures that we can build, because now of late the new ABT, if we can be able to use that facility or that technology, we will be able to extend and expand issues around making sure that we have more beds and equipments and so forth. So we are working with DID as well to make sure that and also clinicians also to assist us in terms of making sure that we also incorporate issues around equipment as well. And we acknowledge, Chair, that Tembisa is servicing quite a large number of population. And the other thing that we also picked up when I went there December was that maternity ward is also having a challenge, is overcrowded. And from only that day, I think most of the babies came from Tembisa, and all of us understand that Tembisa has a lot of foreign nationals, and you find that more than 50% of the babies that are born there are from foreign nationals. And yesterday, the portfolio committee, I think a chair was also saying, how do we also make sure that the other countries are also paying for the people, for their people, if they access our facilities. And Chair, just to promise you and commit that we're also looking into issues of HR as we will be implementing the recommendations of the health ombuds, Chair. And we have already started. This morning I presented the report to EXCO. We have given the CEO the CEO a letter of intention to suspend. And Chair, as we all know that as a CEO, they are at strategic level. But if you can read and go through the report and the findings of the ombuds in his recommendations, he says the CEO allowed himself to be misled, because when it was reported to the minister, when the ombuds was starting to investigate, they had to write a report to the then MEC, Dr. Masuku, and to the health ombuds. And then when the investigators came on site, they then realized that both the two reports were not talking to each other. There were some discrepancies that were in the first report and in the second report that went to the ombuds. And when I engaged the investigator, she said because they had an opportunity to correct that when they submit to the ombuds and write to the MEC to say, MEC, we did not add this information, or we have corrected here. He was supposed to have picked that up. And we are also going to be working with the family in terms of making sure that when the HOD went to introduce Mabuhosi, who is the CEO at Charlotte Maxeke, she will be the one who is going to be the acting CEO until we conclude the process of allowing people to clear their names, because we're saying this is not supposed to be punitive. It's supposed to also be used as a corrective measure. So we will allow people to clear their names within the confines of the law, and without saying this one is wrong, that one is right. And yesterday, the people who were also part of this, who were also implicated, some of them, Chair, have considered and apologized. They felt very, very bad. They feel that they also need to have a session with the family, so that they can be able to apologize. Chair, I hope that is the response around Tembisa is like that, and then we will be submitting reports as we implement, as we action the recommendations to the office of the minister. We can also submit that progress reports to you, Chair, so that you can also be able to know how are we moving in terms of implementing those recommendations. And then on the issues of the investigations, I know Honorable Mkhwabe, you were concerned about non-accountability of monies, the PPE story that happened in the past, and safe to say, the SIU investigations are currently underway, and I'm yet to get a report in terms of what is their findings and what is their recommendations. And in terms of the rollout itself, maybe to answer also Honorable Munyai, is that National is the only one that is procuring. We are not going to be procuring. However, because we are using needles, syringes, and your swabs when we do normal immunization of children. This morning, EXCO has approved a task team of MECs that will be chaired by myself, that will be doing close monitoring as we do the rollout, in making sure that we monitor, we make sure that reports are correct. There will also be a technical team, and in that technical team, we have included the CFO. The CFO will be reporting to us the cost and the amount of each and every needle that we use, the swab, and any other thing, your cooler box and so forth. So we will be monitoring expenditure, even though already this is things that we are using on daily basis, but those that will be using, that will be additional now because of COVID. We are going to be making sure that we account for each and every swab or needle and whatever that we will be procuring, because already there's a service provider that is supplying us on that. So it means we'll not appoint a new person. And in terms of transporting and security and issues of security, I think Ntate Malele did explain that Prof. Joint is going to be assisting us on that. We are not going to procure any middleman, Chair, when it comes to vaccines, and the issue around security is of top secret, and the subs and state security will be assisting us in making sure that we don't lose the vaccines or the vaccines when they are being transported. And then the response to Dr. Tembeka, I would really urge or request that I be finished with the patient's details.
Tembekwayo.
Tembekwayo, okay, I'm sorry, Chair. Dr. Tembekwayo, please, because I had been receiving a number of complaints. We had been resolving them. And the Chair, maybe just to say, all is not bad, even under the difficult circumstances that our doctors and nurses are working. We have been receiving quite a number of letters of appreciation, and that also is boosting the morale of the staff, because they are risking their own lives to save others. And in the process, they are contracting the disease, they are isolated, they are also affected psychologically, because in one of our meetings, one of the doctors said, we really need to be assisted with psychosocial support, because we had been doing that telephonically. We have improved, and then now they were also requesting a spiritual support as well, because they are seeing their friends passing on, they are seeing their families, the patients on daily basis, and they say that is also affecting them. And we have improved that, making sure that they can access help at any time. They can call rather than going to the psychologist or to the counselors and so forth. When it comes to the response to Mr. Munyai, I think I've responded on the first one. The question was what good has, or did you say how we manage COVID-19, or what is good that we think we did in managing the COVID-19 in Gauteng? Chair, if I may say, we were better prepared than the first phase. And remember, the first phase, it was something that was new to all of us. Nobody knew about COVID or SARS before then. And then I think for the second stage, we're more prepared. And it was like we were also now monitoring the hotspots. And as Mayor Lerutla was saying, Meli Rutla was saying that we are also taking out our staff to do contact tracing and so forth. So we are managing the hotspots much better, and we were expecting the worst as Gauteng, but I think our plan did yield positive results when we planned with community safety and did the roadblocks. And making sure that people who were holiday makers, as they come into our province, we tested them, screened them, and for me, and giving that information to them assisted us as a province. And what is nice about it, these facilities or extra capacity that we have created and are continually creating, is that we will be having these facilities post-COVID. Post-COVID, we will be able to use these facilities for other conditions, and it's a quality infrastructure that we have invested in as Gauteng. And what also came out, Mr. Munyai, is that we had now a better collaboration and coordination between the local municipalities, the metros, and the private sector and province. We are working in a coordinated way, and the PCC as a coordinating structure for us, it also assists, because as the municipalities are presenting, we can pick up challenges and be able to address them. Chair, if we did not answer some of the questions, I may request that they be submitted in writing. There's another question that was also asked about the West Deep, the Anglo Gold Ashanti. The Anglo Gold Ashanti is complete, Chair, with it will be functional because there's staff, there's equipment. Since Friday, I think from Friday, the department was transporting the equipment that are going to be used there, and we will be launching it officially maybe a week after next. Chair, at least that one is complete. And what is nice about it is that post-COVID, we can repurpose that facility and then be able to utilize it to close the gaps that the infrastructure gaps that we also experience in the province. And with regard to Leratong, Chair, the information that we received was that most of those files that were there were the files that they were supposed to, they were files that were supposed to be destroyed, because most of them were there for more than 10 years or so. But I can't be able to finish the honorable member with the information. I'll have to get it from Memuso as to the process, because they were in the process of surfing them, those that were not too damaged, and then so forth. We will be able to give that report. Chair, thank you very much. I think I'm going to pause, but if there's anything that we did not respond to, honorable members are more than welcome to can send the questions, and then we will be able to respond. Thank you very much. Back to you, Chair.
Yeah, honorable members, I do note your points that you have raised, Dr. Tembekwayo, the question about the patient, and if we can then have it followed up, because right now the details, the name and that the MEC, she can assist us. She did touch on what Honorable Ismail is asking on the Ashanti, but not the details on the infrastructure. And also the question that was raised by Honorable Chirwa on the patient. Can we finish that, Honorable members, the name details, so that she can then reply in full? Honorable Ismail, it's not possible for an MEC to answer questions as to how many interns are there per hospital right now when she's here in the meeting. There's a detailed information that can follow later. And the issues also about how many, what's the breakdown of the QPEN doctors, Honorable MEC? If you can note that, that is just some of the outstanding committee, members from the questions from the committee members. But honorable members, let me just indicate we already have got responses of outstanding questions that I saw in my inbox 2 days ago from Western Cape and from Eastern Cape. You remember we engaged with those provinces. So those will then have to be forwarded to yourself so that we could sift through those that were asked by you. So we also appreciate that provinces do send back their responses to us if there have been other questions that they might as well have not answered completely when they see. Honorable MEC Dr. Mokgethi, you are in the economic hub of the country, and therefore you should appreciate we have got seasonal South Africans who come to Gauteng either as workers or students and go back to their provinces, sometimes go back to their countries. So there will always be huge pressure in Gauteng on any issues, whether education or health. And you will really wish you all the best in upping your game on that. May I also add that in this committee, there are 6 members who reside in Gauteng in a committee of about 10. Honorable Chirwa, Honorable Gela, Honorable Dr. Tembekwayo, Honorable Dr. Harvard, Honorable Munyai, and Honorable Van Staden. So they are watching the whole country.
And Honorable
Ismail, yes. Oh, there's 7. Ismail. Oh, there are 7. So they are watching the whole country, but they are watching their home province much more, and therefore be aware that there are 7 members there who are from your province in this committee. We wish you well in your effort. We would be happy to continue to receive responses from you, and we know that we want to congratulate you on the work that you have started very quickly after 1 week's report of the Ombudsperson progress that you are making there. We appreciate it, but please do assist that hospital. I don't hope that you downgrade it, because you can't downgrade that hospital in a metro. Please up your game in supporting it to remain a tertiary with the necessary support that it is deserving. Honorable members, we are a minute to 6 o'clock. I would have wanted to take another round, but you started working, I know, Dr. Tembekwayo, as early as 6:45 with the minister presenting that launch. And therefore, we are now, please, honorable members, requesting to take leave and call this meeting coming to an end. Thank honorable members for your time. But what we have just, today, I'm convinced that we do need a session of ourselves with the House Chair. I might as well indicate to you that I spoke to the House Chair, and he says he will be available to meet with us, and therefore we will have to just get our in-house issues sorted out very cordially. We need to be cordial to one another. We need to be honorable to the whole South Africans. And I might as well remind you that this whole day's program was live on our parliamentary TV, and therefore we will remind you if you behaved well, and if you didn't behave well, many more other South Africans were out there to see you. Have a good evening. Thank you very much, and bye-bye.
Thank you, Chair. Thank you, honorable members. Bye-bye.
Thank you, Chair. Thank you, honorable members.
Thank you very much.
Thanks, Chair.
Fellow South Africans, life is a priceless gift.